Hey there, cool listeners. Welcome to Cool, Cool, Cool. This podcast is called Cool People, Cool Tech, and Cool Stories, but we like to shorten it. This is where we dive into the intersection of inspiring technology, fascinating people, and captivating stories. I'm your host, Cameron Kitt. I'm a filmmaker, and I run the documentary storytelling company Yo-Yos. And today we're in for a treat because we get to chat with Kate Stumpo, the awesome senior marketing manager at Bruker Daltonics. You're not the only one, right, Kate? But you are one of the more awesome ones, in my opinion. So it's good to have you here.
Thanks so much, Cameron.
So you also host your own podcast. It's called OMG Omics for Bruker. And how many episodes have you guys done?
Yeah, so the omics space, which can comprise proteomics, metabolomics, spatial omics, and even more, needs more visibility. And I think needs a human face to it, especially from Brookers. That was one of the reasons that we started this. And of course, it's catchy. So I really love the name. And I really love that I get to talk to so many diverse people and learn new things.
Yeah. Did you come up with the name?
I did come up with the name.
Yeah, it helps so much to have a catchy name. But for me, it's very similar to the work that I try to do with Yo-Yos, is that you're speaking to these people who have a lot of really incredible knowledge and are used to speaking in a certain way. And you work to pull out these stories of specificity, of what they're doing, what it means. Also, you ask them about themselves. So I think it's great how you're able to kind of crack open these science people who traditionally maybe are not, I don't know, not used to speaking about themselves so much, right? I mean, some of them have been a little harder than others to get to talk about their personal side.
Yeah, I mean, most people want to talk about their research, especially
Yeah.
scientists. So, I think I've learned a lot about that ability to pull a story out of people. I didn't realize how much of a skill it is, but it's really quite enjoyable to tap into that motivation, what got people to where they are, and why they continue what they do.
Yeah. And sometimes you get really amazing answers that you didn't expect that tell you, like, you and I met in person at Dr. Blaine's lab in Emory University, Dr. Blaine Roberts, where he and his wife, Anne, and their research assistants are working to kind of, I think of it as like uncovering or cracking the code of Alzheimer's and ALS and working on things like diagnostics. Um, I mean, when you talk to him, you had him on your podcast. You talk to him, and he starts talking about childhood, frogs, being in nature. Things that like I didn't expect. Right. So a lot of these people, it goes really deep. It goes. So I guess my question for you is, you got your PhD focusing in mass spec. What was your introduction? Like, what got you into this area of science?
So I had a high school chemistry professor who just enamored me with his storytelling skills, with the experiments that he would show, and that passion for education that I think comes from really good high school teachers. And so I knew I wanted to do my undergraduate in chemistry. And that's where I had an analytical professor. His name was Curtis Hansen at the University of Northern Iowa. And he had a mass spectrometer. And I learned how to take those fundamentals from the textbook and apply it to a real question, collect data around it, true hypothesis testing. That's the core to science. But I'd never put it into practice. And again, from that influence, I said, all right, let's do a PhD. Let's dig even deeper. Let's see how it connects to biology in some regard overall.
You had a real love connection with the mass spectrometer
Oh yeah,
instantly.
and it just clicked, like sometimes something is just like, this makes sense. This is what I want to do. This is what I want to be able to tell a story around.
Mm-hmm. I think. So do you remember what was one of those first experiments you were using the mass spectrometer for in that very first professor's lab?
Oh man. So it was using a permanent magnet FTICR, which probably doesn't mean anything to most people. But we were looking at the masses of things because that's the core of mass spectrometry.
Yeah.
And we were doing gas phase ion reactions inside the system. And so it was chemistry in action in real life where you actually detected the products of a reaction.
Mm-hmm. And just for clarification, all of the opinions and things that Kate has said during this podcast are Kate's opinions and not the opinions of Bruker. And any discussion of technology in this podcast is for research only. not for use in clinical diagnostic procedures.
I mean, on the page in textbook, it's one thing, and then you do it and you see the results of it. And maybe you even see some other things that you have to then explain as part of the process.
So that was like, first of all, you had a teacher in high school that you fell in love with the concepts of chemistry because they were such a good teacher that you fell in love with like the textbook stuff. Then you got to see the textbook come alive under the guidance of your hand and see the results come out on the screen. And so that was like a beautiful moment. And now you've had this whole career around mass spec and kind of supporting other people and all this other research, which I think is so amazing. What when you and I talked before, I had this analogy, so I'm going to try and restate my analogy, and then you're going to tell me what mass spec actually is. My idea was like, okay, there's a bag of M&Ms, and if we imagine that all the different colors of the M&Ms have different weights somehow, that's how we know. You take like you drill a hole through the bag randomly, and then you put it through the machine, and the machine tells you based on the weight of the slices how many colors of the M&Ms are in that bag. Is that right? Like
Yeah.
determining
So the
how many
colors
of
are your
something.
masses.
Yeah.
Yeah. So your colors are your masses, and then your peak intensities are how many have been counted overall. And that's a simple mass spectrum. But what can you actually do with that? You rarely have one sample in a real experiment. You rarely have one thing that you're looking for in a real experiment. And so you collect that data, but that's not the final piece of the story. You have to put it into something actionable, something that is relevant to biology, at least in the context that I've grown into in the field.
So yeah, that data isn't actually enough to do something with, right?
Yeah,
Yeah.
or I would say the technology has advanced enough that you don't have to manually interpret what's going on there.
Mm-hmm.
You have additional software, AI, other
Mm-hmm.
things that can bring you to actionable information
And that's getting better and better and better, faster and faster and faster.
constantly.
And
Yes.
you guys are one
Yeah.
of the big companies pushing that forward. And we'll talk a
You
little
know
bit more
what? We
about
tend
that.
to listen.
Go ahead. Go
Yeah,
ahead.
and we tend to listen we tend to listen to our users because they're the ones who are really devoting 24 hours of their day to figuring out how to make things better. So then we go out and say, I love how you're doing this. I love that you're incorporating this. Can we work with that technology? So
Mm.
yeah, we make the instruments, and I think we're an innovator there, like most mass spec companies are. But how you look at it, how you get the end goal information, we have to look to the market. We have to
Yeah.
see what people are doing.
Yeah. And say, what do you wish you had more of, right?
Yeah, exactly. And then it becomes a feedback loop. The market says they want this, it goes to R&D, it becomes a product, and then the loop keeps happening.
So for people who aren't aware of this like arena, I think there are a lot of people who might maybe even work in medical technology or don't, who aren't aware of all the research and science that is happening behind breakthroughs. For the layman who's listening or laywoman, can you give me some breakthroughs that we have today that we should be thankful to mass spec for, that like have enabled things that we have in our daily life?
Yeah, so I think plasma proteomics is a really good example. Figuring out what you can do in a non-invasive liquid biopsy setting. So, plasma is probably the easiest example of that. What biomarkers do I have that tell me XYZ that give me some indication that there's a change in a disease state? So, just like you go to the doctor to get your cholesterol measured and you look at the change over time, can we find any early indications of other things that are going on in order to help with actually impacting human health?
So better detection of cancer is one of the main ones that's coming out.
Cancer is always the biggest. Yeah.
Yeah, wasn't mass spec used in some ways with COVID-19 and like detection, or was that technology in any way
No,
developing?
so that was all DNA based.
DNA,
So
okay.
yeah, so PCR in order
PCR
to
is so different. Yeah.
yeah, it is.
Okay.
Yeah.
So for if you're listening, mass spec equals cancer detection. That's one of the big ones. But it's not the only place it's being used, right? What we saw with Dr. Blaine in his lab, they're focusing on neurodegenerative diseases. But basically, the way I think about it is people who are on the cutting edge of discovery. Is that correct?
Yeah,
Yeah.
I mean, and I think Blaine really described it well. You start with finding those biological biomarkers in a discovery sense. And then
Hmm.
you have to translate it to a true clinical biomarker so that you can use it every day with patients and, actually detect and diagnose things.
Hmm. Yeah, that's the part where I get really confused.
So first you have to know what to look for. So if you only want to
Yeah.
look for red Skittles, you have to
Yeah.
figure that out. You start
Yeah.
with the whole bag, but then, oh, I
Yeah.
only need the red one to tell me something. And then you can
Okay.
turn it into something that's clinically relevant.
That then we can turn into a test that doctors can administer that tests how many red Skittles or certain color M&Ms
And
are in the
that's the
sample.
ultimate goal.
Okay, you
Absolutely.
actually made it really simple. This is part of your superpower, Kate. Um,
Thanks.
so yeah, I'd mentioned you have this amazing career going from being like a professor, a PhD. You're guiding other students. You're working as a bench scientist and alongside them, and then at Bruker and kind of your work, listening to the people who are doing the science and kind of helping guide the understanding. What's been the most rewarding part of your career so far?
So I think I've learned over time that I am a facilitator. And I think coming to that realization empowers me more to do more of that. So it doesn't quite answer your question, but that's kind of how I think about it. Being a professor, the whole thing is educating your students, helping them to do more, facilitating it. And now what I do, being adjacent to researchers, is I do the same thing. I facilitate their needs into technology, of course, with so many other people. It's not just me. I facilitate how to communicate about it to bring value to others in considering mass spectrometry solutions.
And so it sounds like one of the most rewarding aspects is like learning how you experience success is not through putting your name at the top of the like research paper or putting yourself at the beginning of something, but facilitating people. Like basically you're being like a tenfold supporter to get more stuff done. Have you seen people that
Yeah,
you've supported go on to do amazing things and then felt this like residual warmth of happiness?
absolutely. I mean, again, if I think back to being a professor, I have so many students who have become MDs, people who are getting their PhDs in using mass spectrometry as a tool because they had no idea until they were educated on it. Yeah, it's fantastic to see the great things that, maybe my legacy has helped impact for them. And now being in the field with Brooker, when you bring a new technology to a lab and they go, whoa, I had no idea this was possible. This is going to advance my research like nothing else.
You're like, yeah.
Yeah.
We did that. Yeah, I mean, it's got to be a good feeling because all of this research is around things that humanity needs support with, right? Most of it is medical, disease based, and like helping drive quality of life at the back end for other people, and you know, diagnostic tools and things like that. But that's really cool. I didn't know that doctors are allowed to use mass specs. I guess just
I
regular
mean,
doctors.
well, they often get transformed. So, that actual technology,
Mhm.
one of the big applications is in microbial identification. So, you have someone who has they know it's a bacterial issue, a bacterial response, but what strain of bacteria? So, how do you know how to treat it?
Mm.
So, we have a system, not in my division, in a different division, that is FDA approved, FDA regulated for bacterial identification.
So it's just like, yeah, it's probably pretty easy to work hard at your job, right? Because you know that what you're doing is for the greater good. What can you tell
Yeah,
me
and
about?
it's
Yeah, go ahead.
I mean, it's interesting. When I moved from academia into the industry and business world, I was a little bit worried that the business mindset would overtake. But part of what I
Mm,
love about Brooker is it's PhDs who, at the end of the day, have similar goals. And of course, we have to sell the boxes, we have to sell our product to keep going. But the science is the motivator behind it.
so yeah, that it's interesting because you were just at this big conference, ASMS, and when I think of conferences, I think of everybody trying to sell each other something. But from my understanding, this is just a giant conference of these like nerdy doctors and research scientists, right? Who are like all like excitedly sharing their findings with each other. Is that a correct characterization of the
Yeah,
place?
absolutely. It's
Yeah.
primarily a scientific conference, and then the vendors who sell the instruments and support the science are, of course, a big presence. And of course, it gives us a chance to promote our technology. It's about technology in the end.
Yeah. Can you tell me about the most exciting project you're working on right now that you can talk about publicly?
You mean from a scientific sense?
Sure. I just think of whatever comes to mind when I say most exciting. There's whatever
I
bubbles up for
mean,
you.
you know what? We launched a new product this year, and so going through a new product launch and understanding every aspect of that and constructing the message around it and what to take to the marketplace, it's a story. And so I think that's where I excel, and that's what was really exciting, was taking this highly technical thing. How do you make a story out of it? How do you promote it and make it useful? So that's ongoing for the rest of the year for me, and that's what I enjoy.
Say, how can I make sure people understand what this is going to do for them, so that
Yep.
when the instrument sets down in their lab, there's oohs and ahs, and there's like that phrase you said, this is gonna increase the speed of my research so much, or this is gonna supercharge what I do.
Yep.
Yeah, but first before they understand that, there needs to be a story about how that's gonna happen for
Yep.
them, right?
Yep.
They don't just look at the instrument and go, I know exactly what that does.
Yeah, exactly. It's still educating, it's
Yeah.
taking those skills as a professor and just applying them in a new way.
Yeah, I'm sure as a professor, you and now understand this idea of like when you finish saying it for the third time, they've heard it for the first time, right?
Sometimes, yes. It takes many touches in order to, convince a potential customer that this,
Yeah.
one, can do what they want, and two, will be supported, and three, will give them actionable insights at the end of the day.
Hmm. Because first they have to make room, but also, the idea of in their mind, they're like, is this just a shiny thing? Right. And you have to
Yeah.
say, well,
What's
it
new
might
about
be
it?
for
What's
some
different?
people, but for you, here's how it's going to be this like game changer.
Yep.
Yeah. I mean, that makes sense. And every lab has to make these kind of strategic decisions around what and when
Absolutely.
they buy and when they up. I'm sure you've been in labs where they're running. I don't know how old the timsTOF is. How many years has that been around?
So that was
Um,
launched in 2019. It's 5 years old for the
okay.
timsTOF Flex, which is
The Flex.
the version that gives you that picture
Yes.
from imaging.
Yeah, that actually like goes to the computer and shows you, or like actually says, here's an image of what you took. But I'm sure you've been in labs where you've seen technology that's pretty old,
Yeah,
right?
I mean, I've seen labs that still use instruments from when I did my PhD, and it just doesn't have the capabilities that modern instruments have. I shouldn't say
Is it?
modern, that
Yeah.
newer ones.
Is it hard to not? Is it hard to not say something about that when you see
People
that?
know,
Okay.
absolutely. And I've gone in and been like, "Whoa, that is what I used when I got my PhD," and
Yeah.
it's rarely a bad thing. It shows that people bought into a version of the technology very early, and they see the
Hmm.
value. And so they're willing to continue and to upgrade.
Yeah. So that reminds me to talk about. Let's talk about Bruker. So you say Bruker because it's a German company, right? And I
Yes.
say Bruker. Americans probably hit the hard U and say Bruker, but I mean, my experience is mostly with this imaging and mass spec world, but it's not the only thing that they do. They're pretty well known. They're consistently one of the top companies in this area in the market. So, what do you think is the secret to Bruker's success, especially from a marketing perspective?
Well, I think it largely comes down to the mergers and acquisitions that they've made over the years. It started with magnets and the business that could be built around that, and it's evolved significantly. Some of that is from internal ideas of where to enter the market space. Some of it is, from taking up this small company and then figuring out how that works within our ecosystem and how it can complement or bring new value.
So finding that right balance of bringing on innovative new technology into and bringing the right ones in, because in that way you're sort of like, um, what's his name? That really famous investor that like has never made a bad decision. I can just picture his face. But Warren Buffett, right? Like you guys have to be
Yeah.
like Warren Buffett. You have to be like, is this
Oh,
gonna?
sure.
How do we
Okay.
know for sure that this is gonna work and like elevate our um, profile. But like, I mean, you've been there for a few years. Have you seen what have you seen in terms of the acquisitions that really worked well, that really like boosted
So
market
it's
share?
interesting because in 3 years, I think that process is still being refined. It takes time to integrate a new company. Unfortunately, there's often restructuring. And so there's a lot that goes on in the background to make sure that the message and the complementary technology will still be useful in the market. So in the spatial sense, we've acquired a couple of big things, but we're still figuring out that exact complementary message and how that can happen.
Yeah, this might be, I don't know if this is like a crass analogy, but it's sort of like, it's not adopting, but like bringing a full adult into a family. Or maybe it's like somebody who's marrying into a larger extended family, right? If they're marrying in, they have to like get used to the culture of that person's family and like
Yep.
figure out where they fit and make sure that everything like feels, I think that's probably similar. Where you're used to the culture of your little life, and then you're
Yeah.
suddenly part of this big German family that has their certain ways of doing things, right? But also, I think the benefit is they're, I mean, I wouldn't say huge, but like have so much sway and so much power and like support behind it that it's a big benefit for these companies to be taken in.
And we
Um,
learn from them too.
yeah.
Maybe they have processes that will help us to advance and do things better. So it is a two-way street. Just like you said, it's a relationship that you have to
Hmm.
build.
Hmm. And I think you mentioned that you guys listen. Would you say that that's one of the bigger reasons why you're so successful as a company?
Oh, absolutely. I think it was Hillary Clinton when she was Secretary of State who said the first thing she does when she goes into a meeting is she sits and she listens. Because
Hmm.
how can you know what problem you need to address, how you would
Hmm.
respond to it if you don't fully understand? So I think that's also a really good skill that can be applied across your life.
Do you feel that coming from the leadership side at Brooker, that like this like investment in listening, or is this something that's a personal Kate skill?
I mean, for me, I think it's highly important, and even in your home life, with
Hmm.
my partner, it's always
Hmm.
about okay, I hear what you're saying, and
Mm.
here's how we can move forward.
Ah,
From a leadership perspective at Brooker, absolutely. Otherwise,
yeah,
how can you make advancements if you're not
yeah,
listening?
yeah. It's like how can a company be successful if it's not listening or
Mhm.
responding, right? It seems like what I'm hearing is that this is an older business, right? It's been around for how many years?
Oh, I'd have to look it up. Even
I
I
want to
don't
say
know the full history.
60.
I think
At
the '60s,
least
yeah, post World War
60
II.
years, 60 years. So it's a 60-year-old company. Like that doesn't work unless you can like expand to fit the market and grow and like adjust. Now for you within your specific arena, what I really appreciate what you said is that you were fearful of losing your like science self a little bit to going into a more marketing role, and that you didn't have to lose that at all because it requires you to be your science self. I was actually talking about you to our podcast manager, and I was like, yeah, well, I mean, Kate's the perfect person to talk to these people because this is the work she's done, and like she knows it so deeply
Yeah,
and intimately that it just is second nature. You really understand what they're going through and what they need,
yeah,
because you
yep.
were that person.
Yeah, I
So
mean, I think my career was ideal because it's you take a core set and I keep adding to it in terms of skills, and I don't lose the previous ones,
yeah.
at least for me.
Well, what's the biggest challenge in your work right now as a marketer?
Um, I think that the work we do in the spatial biology sphere is still seen as new to a lot of people. We have our core friends and family mass spec people who are totally bought in and will continue to make advancements and innovate. But as we start to target, those other markets, and as we start to talk more to people looking to translate their biomarkers into a clinical sense or clinical research sense, I should say, there's still a little bit like, wait, has this been out there? This is new to me. And so we have to reassure them, yeah, Maldi's been around for 30 years. And we've been a part of that for 30 years. The tech is solid.
Here's an analogy. This would be like me going to people who buy audiobooks and say, "Did you know that the library offers this for free and it's been doing it for years, and they say, what? No.
Yeah,
I mean, in this case, you guys actually want them to buy the audiobooks, but it's sort of, maybe it'd be like if they've been reading and you say, did you know that there's been this thing that's been making it way easier that you can listen to the book in your car? And they say, I don't think that's true. You're saying,
absolutely.
actually, people have been listening to audiobooks. That's really tough because you have to say it in a way that doesn't hurt their ego, right?
Oh, absolutely. It's part of it's that's where I think the interpersonal skills come in.
Mm-hmm.
Being able to talk to people. That's why you listen first. You figure out what their research question is, and then you say, "Have you considered bringing in something like this, which will help you answer X, Y, Z within that question you told me at the start?"
Can you give me an example of how you had this conversation?
Um, yeah, I mean, it's called the challenger model of sales overall. So, yeah, I listen to someone who is trying to translate a lipid species that they know is unique in Alzheimer's disease. I'm just picking a random example. They want to use that to enable better diagnostics in the end for that particular disease. Um, so, first, you have to go through a series of clinical research steps. So, when we talk to someone about the clinical research that they want to do, they say, yeah, I want this blood based system. Or, yeah, I want to be able to see, sorry for the dings, I want to be able to see what's going on in the system. And we say, that's fantastic. How are you doing that right now? You listen first and then you figure out what they're doing now. And then you teach them about your technology. All right. So, I love to hear that you're looking at these species, but the lipid still is kind of set out against that. So, how can our technology help you? You teach them. And then you go back and forth on it.
So if someone was, I love this example. If someone was trying to isolate this specific, you said lipid species?
Yeah.
Okay.
Yeah.
Um,
Molecule.
yeah. And then the ultimate goal is to make it so that in a clinical setting, meaning at the doctor's office, this is further down the line, someone can get a test done, a blood sample or something that tells them whether or not they're going to have a high likelihood of having Alzheimer's. This is like kind of what Dr.
Yeah.
Blaine is working on. It's incredible. It's like going to change how we do clinical trials and all this stuff, right? That's like a huge benefit for society. But but what are they doing right now without mass spec to identify it? Like, what is the typical thing that's done in this new world for you guys?
Well, I would say within the part that I do, the multi imaging, often what's missing is that spatial component. So, do you know exactly where this is happening? Because that can influence what type of drug target you would use. That can influence even the movement of targets or metabolites and biomarkers from one region to another. So, I think what's often missing with what we look at is taking that bulk look or that bulk picture and adding into it the spatial sense. So think about a fruit salad.
Mm-hmm.
I can look at all of the different fruits are there, but I don't know what was next to each other. So if I add the spatial component, I can actually build a map of what was where, which enables me to dig deeper into the apple or enables me to dig deeper into the
Uh,
pear.
or develop a drug that's going to be able to find an apple
Yes.
easiest because there are
Yes.
different ways of delivery. Okay.
Yes.
This is like my brain always is like doing these like push-ups when we're on calls together, Kate. Like I'm learning from you guys and my brain is like literally sweating. It's so interesting because it's actually like when you break it down that simply, it's actually not as complicated overall as as I thought it would be. It just is a matter of, I guess I never thought about like, so when you say where it is, does that mean like within the brain or within the cell? Like, okay.
We don't do subcellular, but there are other technologies in spatial biology that do. So,
Okay.
yeah, again, depending on your question, depending on what
Okay.
you need to know, it helps you figure out what technology will help you achieve it.
And in that way, it's not really like, I wouldn't say like traditional sales, or in that way, it's not the way that people think of sales in a traditional sense. And that you're just trying to go to find people who are really going to benefit from this extra tool that isolates it where it is in space, right? They're currently able maybe to isolate it, but isolating where it is in the fruit salad is going to help them a lot, and they don't know about it. So you're just going to people and saying, "Did you know?" Well, I'll talk more about that in a second, but first, Today's episode is brought to you by Yo-Yos. It stands for You Own Your Own Stories, a documentary storytelling company where we demystify cutting-edge tech through emotional human stories. If you have a cool story to share, we can help you get it out there. Okay, so now I'm going to ask you more about Bruker. We talked about them. You've been there for 3 years, you said? Yes.
Yep.
Um, if you had, if your company could collaborate with any celebrity, who would the celebrity be, and what would be the epic project? 'Cause I'm a movie person, right? Like, what would be the celebrity that would represent a big win for you guys? Maybe we'd get the mass spec or the science
Oh,
community
wow.
excited. Yeah.
A fictional character or the actual person?
It can be anything you think of that represents maybe the company vibe.
Yeah, I'm trying to think of people who have an advanced degree because, again, that's such a core part of
Mm.
who Brooker is. And I think of Natalie Portman because,
Mm.
she did advanced work in the sciences, and that's just amazing, and she pivoted her career, and perhaps, she could say something fantastic about PhDs going into industry because she went into an
Mm.
industry as well. It was just the movie industry. So from a
Mm.
personal story sense, I think there's a neat analogy there.
Well, I also think that's just a good idea. In general, you guys should reach out to her because that would be. I didn't know that about her, so that's really cool. Yeah, finding someone who has an advanced degree and I mean, in a lot of ways, you and her are similar in that like it's now about reaching a massive audience. She's not doing it for the sciences anymore. But how do we become the facilitator of storytelling?
Fact
Um,
check that though. Make sure I'm right.
well, let me look it up. Let me look it up. Natalie Portman degree. But this is just interesting to think about um, what were the potentials? Let me see. Degree. She went to Harvard,
Yep.
studied psych, and then I don't know. Let me look. Oh, it's not. It just says that she has the humanities. We'll fact check it, but I think
Yeah.
regardless, we know that she did the sciences. Um,
Yeah, absolutely. Yep.
so, Kate, if we're talking back to your specific audience, which you mentioned this, you guys have started to transition to this. When you say the clinical translational space, is that right? The new
Yeah,
area?
I mean, first you go from discovery to figure out what you're looking
Hmm.
for. Once you know what
Hmm.
you're looking for, you translate it into clinical research to make sure that it's viable
Hmm.
within, a clinical trial setting or something like
Hmm.
that.
Hmm.
And then the next step would be to actually implement it for clinical purposes, which is not Brooker's specialty. And my division is not FDA cleared for, but that would be, the next step overall.
Hmm. And so that's a new audience for you guys. What do you wish they knew? Do you like? I guess I think in general it sounds like you're just saying you wish you knew that multi imaging existed. Is that right?
Yeah. So you have a solid biopsy done because there are no known blood based biomarkers. And we do biopsies a lot to look at things from a histology sense. So you stain, you get a picture of the tissue, but you really only see cell type. You don't see enough information about subtypes and what's going on that way. What do you need in cancer? You need to know what subtype it is to know what drug will treat it most appropriately to get the best patient outcome.
Hmm.
So, simple histology, which has been around for so many years, is not enough anymore. And if we have new technology that can help complement that, then that's part of the message we want to promote.
Yeah. Especially when um, being a institution that can be a leading. Let's talk about cancer, right? When we talk about biopsies, can be a leader in that space. It's a very important message for them to know about because that's what they all want, right? First of all, we want to make people better as best we can. Um, so it's not like they purposefully want to stay doing histology; they
Yeah,
just don't know.
exactly. Yeah.
Yeah, go ahead.
Well, and then maybe that, spatial biomarker could then translate into a blood-based biomarker. So that's why we're still really in that research space. If you get a large enough cohort of patients and you see over and over and over again that this one molecule is showing up, then you have to go see if you can find it in the blood. And then you
Mm.
have a less invasive technique for impacting and diagnosing and doing appropriate treatments.
Oh, my brain just like clicked. You were saying if we can find this molecule that is connected to this right subtype, then we could make a blood-based test instead of needing biopsies.
Yep.
Yeah, and that
So
might
if
even
we can
catch it
figure
sooner.
out, yeah, so within the apple, if we figure out that it's the stem that's important,
Hmm.
then hopefully we could translate that to blood and be able to detect the stem or some part of the stem or something related to it.
Wow. Yeah, people don't. Nobody likes getting a biopsy if we can
Yeah,
avoid it.
yeah. But if again,
Yeah.
if you know where to look, if you know what's important, but first you have
Mm.
to figure out that part and do that discovery work.
And part of this is that there's just so many types of cancer, right? Like that
Absolutely.
there's no such thing as like there's no one type of cancer, and so I like the more isolated you can get, there's a whole range of space that everyone
Yep.
needs to be focusing on.
Yeah.
So in a more general, broad sense, what trends do you see shaping the future? Like I'm thinking like 50, 100 years from now, the future of life science research.
Um, if I think part of the goal when you go to the doctor is to find a trend. You get a regular blood test once a year and you see a trend of, like I said before, cholesterol and things like that.
Hmm.
What if you had 500 things to look for that would be early indicators for 500 different diseases overall? That to me is the ultimate goal. Will it happen? I don't know. But I think that's the pie in the sky idea that you want people to reach for and continue doing their research on.
Wow. To me, that just kind of sounds like the thing that Dr. McCoy would have in Star Trek, where they just kind of like wave it over you and it
Yeah,
would
I mean,
beep.
yeah, if you can figure out what's wrong earlier, you can treat it earlier.
Yeah, that is such an like I was gonna ask you like what is the coolest thing in this space to you? And that gave me the cool tingles. What I mean,
Yep,
not just what you're working on, but the future. What would you say is the coolest thing in this world for you?
I think that might be it. Because
Yeah.
again, at the end of the day, it's how are we facilitating better outcomes? And
Yeah.
so if our instruments, if our technology helps to facilitate that, that's a win for me. That's like the ultimate win.
So this like yeah, I'm gonna call it the Star Trek diagnostic. You go to your physical, you have one vial of blood, right? Normally I have to give four if I'm doing like a whole physical panel, right? But this future state is that one vial of blood could be tested against 500 potential known diseases to see if there are giveaways that I'm on the track
Yeah.
to either develop breast cancer, I mean, osteoporosis, or certain kinds of things. Now, on the one hand, part of me is terrified to know it, but I also did get the BRCA test done, right? So, like, we want to be as aware as we can so that we can be preventative and get, catch things early, right? I mean, what do you say when people say things like, "I wouldn't want to know"?
I mean, I think it's always about personal choice.
Mm,
And that's okay. And that's a philosophical question that's going to come
mm,
back to the individual.
mm,
Would I want to know? I don't even know. Maybe
yeah,
if I'm faced with a history within my family,
yeah,
it's a tough decision to make.
yeah.
Probably literally make a pro con list because that's the kind of person I am.
But I'm hoping that if we're at this like 100 years from now, or hopefully less, where we have this like master diagnostic, we would also have like more powerful preventative tools and drugs
Oh
and
yeah, I would
techniques, right?
certainly hope
So
so. That the
I
the
would hope,
pool of medicines, yeah,
yeah, would also be matching it. So if I say, oh, likelihood of, for me, like breast cancer is in my family, I know it is. And so it's like if there was a way to know, how, like, I don't know if it would say percentage wise, right? What if it would say like at age 64, this will happen to you, right? I don't know what would happen,
no, I
but
don't think you could get that specific.
no, but then I could hopefully get on a like a regimen that would help prevent that or adjust that. So,
Yeah, and
um,
hopefully we would have drugs that were preventative, because we
mhm,
understand tumor initiation better. So we understand how to halt that earlier and
mhm.
something doesn't even turn into cancer at a late stage.
But that when I think of like the word cool, that's the cool thing to me
Yeah,
is like the idea of like kind of opening up the box for possibilities instead of just thinking about what we've always done. And I think that's
yeah,
similar to what you said with histology is like let's think bigger, bigger, bigger. about how we
Hmm.
could face this. And it's what's
Hmm.
really cool about Dr. Blaine and this, like when I see the specific examples, it really everything kind of clicks. Um, what about AI? Is Bruker working with AI in any way from a futurist standpoint?
Yeah, so a lot of our software incorporates machine learning to do better classification and predictions. And so that's definitely in this space overall. I think most companies like us are doing that because we realize the value and we understand that it will shorten the time to answers, and may even help in a predictive sense. But then that all has to be validated. So that's part of the phase that we're in right now, is making sure that those predictions are accurate overall.
Yeah, because I've learned this word doing a lot of AI research called hallucinations. Have you heard of this?
Yeah,
Where like,
exactly.
yeah,
Yep.
where it's like we kind of a lot of people think of AI as like a panacea, but really it's becoming more like asking a person a question, right? And like
Yeah.
sometimes you ask a person a question and they give you the wrong answer or they say I don't know. And sometimes these models will say like um, yeah, the best way to get there is by horseback or whatever. Like you're
Yeah.
like, oh, that's actually not related at all, or
Yeah.
so I think what I'm hearing from you is like you guys aren't looking at it as this like save all, catch all thing. It's just going to be another tool to help elevate the work, right?
Yeah, exactly. I mean,
Mhm.
and as a researcher in the disease space, you need as big a toolbox as you can get, to make sure that you catch every angle.
Yeah, well said. So, if you could ask everyone listening to this podcast, Kate, to do one thing after listening, what would it be?
So this might be a controversial one, but I'm going to say don't hate big pharma as much as you might,
Oh.
because most of big pharma puts at least 50% of their profits back into R&D, because it
Mm,
takes 10 years to bring a drug to market. That's a lot of infrastructure, that's a lot of researchers, and support that has to go into that. And I think before I joined Brooker, I didn't necessarily understand the space and the process. So I know there's a lot of hate out there. I understand the challenges around prescription drug prices. Um, don't want to get into that as much because a lot of that's government regulated, but don't hate them as much as you maybe think. They're not the big evil.
that is controversial, and it's interesting. I'm reading this book called Stolen Focus. It's so interesting. It's about like how certain apps and the way we've like all the information and like how our attention spans are getting shorter and things like that. But he talked about how I guess like the it's hard to hold these two things in mind at the same time. One is that yes, I can have these opinions about I don't think certain drug focus is as important as other ones or whatever, right? Or I don't know if we need another asthma drug when we could be doing this. That's just my personal opinion. I'm not running the business of the world. It's harder to say, oh, yeah, look at all the things that these drugs have done for humanity, or like thinking about the polio vaccine or something like that. Like, it's hard to hold these two things where it's a lot easier to be outraged. And they're one of the easiest ones to be outraged at. So it's like, don't take the shortcut to
Yeah.
outrage. And that's what a lot of news tends to want us to do.
Yeah.
So that's really interesting. Okay, how can one go about opening their mind towards big pharma? Do I read
I think
about
you have to
this?
separate. Well,
Yeah.
and I think you have to separate the science side from the CEO and the business side.
Mm-hmm.
And so don't hate the scientists, which are a part of that story. You have to hold both of those in your mind. And as I've
Mm,
gotten to know so many scientists in pharma, they want to solve problems. They
mm.
want to have the next big thing to impact a disease. And so their heart is in the right place, and they're a PhD scientist at their core, the ones that I've met and interacted with.
Oh, this is like mind
CEOs,
blowing. Yeah. Go ahead. Keith.
yeah. Well, and I mean, take that as any analogy. Take it to politics. Look at the top side versus each individual representative, maybe, or
Mm-hmm.
even representatives down to the state and local level.
Mm-hmm.
It's different. You have to think about the organization versus the individuals.
Yeah, just because someone got a PhD and is researching and they're passionate about something and then they go to work for GSK or whoever, right? Doesn't mean they're a sellout, right? Doesn't
Yeah.
mean they're a bad person. They're still trying to do some. Still trying to pull through what they cared about as a kid or whatever got them into this, right? Um, I'm going to try and do that. I'm going to go ahead and do that, Kate. I'm going to take your advice. But this has been fantastic. Thank you so much for, again, giving me another primer on mass spec and science and this kind of cutting edge research, especially with imaging. Who do you think would be a phenomenal guest for our show that you know has good stories?
I mean, remember, most of the people I know are chemists and are mass spectrometrists. So I'm not sure if you want a repeat overall. um, I think you should find a history professor. I can actually think
Mm.
of one at the University of Scranton where I worked, who would draw you a lot of parallels between science and history and the research process that goes into it,
Mm.
and even the crossover in terms of human impact overall.
Ooh, that's a great idea.
I
Because
could send you some names.
another controversial statement is I think history is so cool. Like, I think the stories are cool, and I think the more you dive into it, it's like the more you learn about history, the more you know about the future, right? Like,
Yep.
the more
Yep.
predictive you can get. Well, that is our show. Thanks for tuning in, cool people, to our podcast. Cool people, cool tech, cool stories. I'm Cameron Kitt. A huge thank you to Kate Stumpo for joining us and sharing some of this behind the scenes info about Bruker Daltonics. You can check out the show notes for links to Bruker and Yo-Yo's websites and to Kate's amazing podcast. And let us know your thoughts on this episode on social media using the hashtag #CoolCoolCoolPodcast. Kate, thanks for coming on.
Of course. Thank you.